How to conduct the primary survey?
The primary survey include Dr. ABC, which is danger, responsiveness, airway, breathing and circulation. Okay, first before I have arrived to that scene, I need to make a survey, which is the primary survey. The first primary survey is danger. So I need to make sure the environment or the surrounding around here is safe from danger. It includes the victim safely and me. So I will move the part of the accident happen. Okay, now for sure the victim and I have moved to the safe area. After that, I will move to the responsiveness, which means I need to make the AVPU scale to check the responsiveness of the victim before we undergo to the next primary survey. So the AVPU scale is referred to the alert. So now I will use my hand to tap gently at the victim's shoulder and make a voice to call he or she. Sir, if he did not make responsive, I need to give some pain to make sure the victim is totally unconscious or not. So I will pinch at the ears of the victim. So there show that the victim does not show responsive. And next I will activate the EMS, which is emergency response service, to call to the 999. Then the method to call to activate the emergency response service is I need to find someone nearby to me to ask for help to call the 999 for activate the emergency response service, or I need to use my own handphone to call or to activate the EMS service. Okay, next I will move to the airway survey, which I will use the haptic chain lift maneuver technique to check that have the object that obstacle at the victim mouth. So the technique is I need to haptic the victim head and chain lift to open the victim mouth. So I need to see if they have object that obstruct at the victim mouth. So if there is no any object, I need to move to the next survey, which is to check the victim breathing. Okay, now I will proceed to the breathing survey. So for the breathing survey, I need to check whether the victim have the breathing or not. So the technique is I need to near to the victim mouth and nose to check whether the victim produce the heat of breathing or not. If no, then my eyes need to same level to the chest victim to see whether the victim chest have breathing raise up or down. So in my view, there is no sign of breathing of victim. So I need to proceed to the next survey. Okay, for the last survey for primary survey, I need to check the circulation of the victim. The ways to check the circulation is we can check the victim pulse, which is radial pulse. Is it have the pulse or not? After that, we can check at the neck of victim, which is carotid pulse. So this is two ways to check the pulse of victim, whether the victim have the pulse or not. If the victim did not have the pulse, we can proceed to the CPR. Okay, next I will proceed to the further treatment before waiting for the emergency medical service arrive to our scenes. So the victim show no symptom or sign of life. So I need to make a CPR. CPR means the cardiopulmonary resuscitation. This technique help us to make the victim can pump again his or her heart, or to make her heart beat again. So in this video, I will show how to make a CPR to infant, children and adult. Let's go. Okay, now I will show how to make a CPR to the infant and to the children and also to the adult. So first of all, we need to know how to counting the compression. The technique to counting the compression is we need to count like 1001, 1002, 1003 until 1120. So this counting technique is used to make the compression to infant, adult and children. So when we want to make a CPR, we need to place our body at the behind of the victim, either the left side or the right side, and we need to make sure our shoulder is locked and our hand is straight parallel to the victim. Okay, now I will show how to make a CPR to the infant. To make a CPR to the infant, we need to use 2 fingers and find the middle of the chest of the victim by using our 2 fingers, place at the nipple of the infant and slowly move the finger to the middle of the chest to find the area of the sternum and put your 2 fingers at there. And to compress at the infant, we need to compress about 1.5 inches there. Okay, now I will show how to compress the infant to make the CPR. Okay, now I will show how to make the CPR to the children. To make the CPR to the children, we need to use the heel of one hand and find the sternum area, which is form 2 fingers and place at the nipple of the children. Slowly move to the middle of the chest and find the sternum area. Then put the heel of one hand at here. After that, we need to make the compression about 2 inches there. Okay, now I will show how to make a CPR to the adult. The technique is we need to use 2 hands to make the compression. Firstly, we need to find the sternum area, which means we need to make 2 fingers and place on the nipple of the victim. move the finger to the middle chest of the victim and find the sternum area. Put our right hand, which is our heel, to the sternum area, and the other hand above the top hand, like this, and make a compression about 5 inches depth. Okay, in conclusion, the CPR technique is important to make sure we able to save the life of victim that having any incident or accident to other area. So CPR is referred to the cardiopulmonary resuscitation, and we can make the CPR to infant, children, and also the adult. Make sure we need to use the correct technique to the different ages.
How to apply a proper bandaging technique? Use a gauze to cover the incision over the head. Ask the victim for the help to hold the gauze over his head. This bandaging technique is start from the sideburn of the victim head and will round over the victim head. After finish 2 rounds of rolling the bandage around the victim head, it will twist at the starting anchor to make sure the bandage is round over the forehead of victim. The end rope will tie at the anchor of the bandage. This bandaging technique is used to cover the head incision, forehead, and also jaw injury. Next, we use the base folding type to perform the scalp injury. By using a triangular bandage, we need to perform the base folding type and place the base folding type of triangular bandage on the forehead that cover all the victim head. Alternate the top end and loose end to bring it up mid at the front of the forehead of victim. Use the double overhand knot to tie the triangular bandage. This bandaging technique is able to cover any incision and bleeding that happen on the victim head. Using a elastic bandage, we will cover the radial or ulnar injury. This spiral reverse bandaging is able to give the support or pressure to the injury happen. The twist part is function to give extra pressure and support to this bandaging technique. Make sure this bandaging technique is not too tight and not too loose because it can affect the circulation of the victim. By using a elastic bandage, I will perform a elbow figure of 8. Firstly, we need to make a starting by rolling several of the elastic bandage around the forearm of victim. Then, alternate the elastic bandage over the joint of elbow and bring it back to the normal position and continue that movement to form the figure of 8. Figure of 8 technique can give a support to the joint area. By using a elastic bandage, I will show how to make a bandaging technique to the chest area. Firstly, we need to make an anchor at the victim hands. After finish several rolling at the victim hand, we will roll it around the victim ribs to cover the area of chest injury. Make sure the bandage that roll onto the victim rib did not too tight because it can affect the breathing rate of victim. The rolling will be end at the starting anchor and tie it nicely. By using a elastic bandage, I will perform a ankle figure of 8. For the first step, we need to roll the starting bandaging by make several rolling. Then bring the elastic bandage down to the foot and bring it back on the starting position. Continue the movement until it forms the figure of 8. Figure of 8 bandaging technique is usually used at the joint part. It because figure of 8 bandaging can give support to the joint part. Now I will show how to make a donut shaped bandage. Then it will be used when any puncture injury happen. So the donut shaped bandage can give the pressure at the round of the puncture to the skin. Donut shaped bandage and bandage can be used to make a puncture injury bandaging technique. Firstly, bring the donut shaped bandage over the punctured object and place it around the punctured object. It because donut shaped bandage will give pressure on that area. Then cover the donut shaped bandage with the bandage. Make a several circular bandaging technique. The function of donut shaped bandage is it able to stop the bleeding and give the pressure around the punctured wound. The function of first aider is to provide a puncture bandaging technique, and the responsive of to remove the puncture object is the professional one. How to provide a proper sling technique? By using triangular bandage, you can perform the arm sling. Arm sling is a technique to hold the arm in a horizontal position and treats upper arm injuries and wrist injuries. For the first step, use triangular bandage, pass it underneath the arm and over their shoulder. Bring top end around the shoulder, then bring loose end up to meet it. Use a reef knot to tie it. Make sure the victim is comfort and twist it until it become nice. Sling technique is used to immobilize and prevent further damage. By using a bandage, you can make a sling to support your hand injury. Firstly, make a loop, and the bandage loop is underneath the victim hand. After that, the top or end of the bandage is enter the loop. Make sure the bandage is comfortably to the victim arm and bring the top end and loose end up to meet it back of the victim neck. They have several overhand knots to make the bandage support the victim arms. After finish perform the sling technique, make sure to check the circulation. You need to squeeze the fingernail for 5 seconds. When you let it go, the color must return within 2 seconds. Keep checking the circulation every 10 minutes. After that, for the splinting technique, we need to find the area of broken to make a splint. First, we need to have 3 bandage or rope to tie the splint object at the broken body part. We need to find 2 objects to make a splint around the broken part. Firstly, we need to make sure the broken body part is immobilized. Then, the object that we will use is suitable to the area. To apply the splinting technique, we need to put the object at the behind of the broken part to make the support or to immobilize the broken part. Tie the bandage or the rope to make sure the object splint is give support or immobilize the broken part. Make sure the splint object did not puncture to the skin of the victim. Lastly, make sure the splint object able to give the support to the broken area, and every 10 minutes you need to check the circulation.